Hey, odd place to be, but this is where I wish for you to be. This is Dr. Shakib, and this has to do with an exercise for pelvic floor dysfunction. Stay tuned. Okay, so one of the things that need to happen with all pelvic floor dysfunction cases is for the whole body, the stabilizer, to be doing their stabilization. With all of our patients with pelvic floor dysfunction, in the forms of incontinence or not, their movement is not ideal. It's dysfunctional. So in order to make it functional, you have to understand some very basic concepts. Your torso and your neck, their job is to stabilize you while your upper and lower extremities are doing the movement. So if you're borrowing your legs to, for instance, support your hips, your lower back, your lower ab, support you in an upright position more than what the legs are to do. When the legs have to do the legs work, that corner is gonna collapse and lose its integrity. So over time, that leads to dysfunction. So then first thing you need to understand is how to breathe effectively. We've done a video on the difference or the correlation of breath and incontinence and pelvic floor dysfunction. So we're gonna make sure we put at the end of this video. But to start, to really allow your whole spine to be in a more relaxed position, which is necessary if you're trying to build strength, you need to start with neutral position. So in most people, neutral position is not even neutral. So in order to do that, in order for you to breathe effectively, either with spastic or more of a spasm of the pelvic floor muscles or even the bladder in incontinence or dysfunction as a result of associated musculature relating and influencing the pelvic floor, whatever the cause may be, the spine has to be nice and relaxed, so then we can incorporate the breathing there. So in order to do that, you're going to be on your back with no curvature in the lower back or mid back. So right now I can slide my hand right here, but if my whole spine is in a neutral position, not because I'm shoving my knees into my chest area to try to make it neutral, but because the muscles in my back, front, sides, along with my breath, are keeping my spine nice and against the floor. That is a neutral spine. So when that happens, my legs get to do their job, my arms get to do their job without lifting my shoulder blades here. Most of us, when we're moving our arms, our shoulder blade gets lifted as if that's part of the package, when in reality it's not. Your arm length is from your shoulder to your finger, not including your shoulder blades. So these are as simple as they are. That's the position you need to start practicing, keeping your whole spine on the floor. Your neck is not all arched up, but nicely in a neutral position, and move your arms and your legs without your spine lifting up, without you tilting your spine up. A very, very simple exercise, but if you think about it, all babies start from that position. Oh, that's what the foundational piece is for every single movement. These are the concepts behind functional movement, neurokinesiology. We will put a link to the concept of neurokinesiology so you can better understand it. If you have any questions, use one of the methods of contact in the description box. Don't hesitate to contact the office. And until next time, take care.